Welcome everyone. Categorization of hurt is challenging at times, and here is a simplified version with sample MCQs to be practiced before your examinations. What is this hurt business and categorization of hurt? The answer is here. In a ward, we see patients with injuries. A surgeon looks at these injuries to treat, or they assess the severity of injuries for management purposes. When it comes to a forensic doctor, we have to look at the severity of injuries with the legal context as well. That's why the word hurt is discussed in forensic medicine. If we see it superficially, wound, injury and hurt, basically we tend to use these words interchangeably, but there are definitive differences as well. The term wound can be used in day-to-day activities in the medical field, but there may be exceptions as well, definitely. However, legal terms injury and hurt are legally also defined. Injury means, in the Penal Code section 43, injury means any harm caused illegally to any person in body, mind, reputation or property. You can understand now, these are the words that you have to understand. Harm illegally caused to any person in body, mind, reputation or property. When it comes to the bodily injuries, now the term hurt is separated. Penal Code 310 encompasses bodily pain, disease or infirmity to any person. When the hurt is more severe, it is described in Penal Code section 311 as grievous hurt. It's clear now different specialties assess severity of injuries differently. A surgeon assesses in order to manage patients. However, a forensic doctor assesses injuries based on the law of the country, that is hurt, grievous hurt, embedded in the penal code. A forensic doctor should use his medical knowledge in addition to the legal knowledge during this process of categorization of hurt. Discussing more about hurt, that is illegal bodily harm, is divided into 4 categories. That is non-grievous, grievous, endangering life, fatal in the ordinary course of nature. However, if one gets extremely severe injuries, he is going to die and can't see in the ward to fill an MLEF to indicate the categorization of hurt. Such injuries are termed necessarily fatal injuries. Detailing the categorization of hurt, to start with the less serious one, that is non-grievous, grievous hurt, endangering life, fatal in the ordinary course of nature. So this is the most serious one. What are non-grievous injuries? These are simple injuries. These are simple injuries that do not add any significant harm or permanent damage to the victim. Actually speaking, there is another way to define it, that is less severe injuries that cannot be included in the 9 limbs described in the section 311 of the Penal Code. Grievous hurt and endangering life I am going to discuss together very soon. Details of the categorization of hurt in grievous hurt and endangering life are embedded in the section 311 of the Penal Code. What do you mean by fatal in the ordinary course of nature? As the term explains, if the victim is left untreated in prompt and proper way, the victim will die. The victim will die. The probability of death is 100%. Actually, these are serious injuries, and if victim happens to survive, with prompt and proper medical treatment, the assailant is charged under the offence of attempt murder as mentioned in the Penal Code. Now imagine a situation where a victim sustained a small pneumothorax. We are going to discuss about endangering life now. So now there is a small pneumothorax. What would be the medical management? The medical team puts him under observation as it may cause respiratory failure. That means an existing threat is there. Let's consider another example. After a road traffic accident, one got a rib fracture, but no pneumothorax. However, one can argue that there is a potential to develop hemothorax in this patient too. So now you can understand the existing threat and a potential threat. To elaborate more on the same thing, imagine a skull fracture. One may argue that the person may develop meningitis. That's true, but not developed yet. That means it is only a potential threat. A potential threat is there. However, imagine a situation with the same skull fracture. A person has developed meningitis already. So that means an existing threat is there. That is, with this infection, patient may die. But the condition is not severe enough to die the patient or to tell that the probability of death is 100%. The difference is patient may die and patient will die. If the health condition or the trauma is severe enough to kill the patient, unless there is prompt and proper treatment, the categorization of hurt is fatal in the ordinary course of nature. If the condition is getting an existing threat or with the condition the person may die, the severity or the categorization of hurt is endangering life. Let's discuss about some more examples in the category of endangering life. What do you think about concussion? During the concussion, patient gets an episode of loss of consciousness. As a result, there may be accidental aspiration or tongue falling back causing asphyxia, or there may be certain other complications. And small pneumothorax or hemothorax, small liver or heart contusion. In case of small heart contusion, there may be heart failure or arrhythmia. An existing threat is there. Cut injury involving vessels below elbow or knee, or reversible shock, or existing complications that we have explained already as meningitis, gas gangrene, or tetanus. So now these are the conditions where an existing threat is there already that are developed but not are potential complications. Moving on to the necessarily fatal category. Here, um, injuries are so severe and no hope for life even with the best prompt and proper medical care. So you can understand now, the victim die definitely and no treatment options. We have so far discussed about 3 options. Patient may die in case of endangering life. Patient will die unless there is prompt and proper treatment. That means fatal in the ordinary course of nature. And the last one is patient definitely die even with the best prompt and proper treatments. What are the examples? Decapitation, severe crush injury to head, total destruction of liver or aorta, severe injuries to heart, liver beyond repair, brainstem damage, complete transection of upper cervical spinal cord. In such a hurt, the assailant is charged for murder and the punishment is murder or death penalty. Section 294, murder, and punishment is embedded in section 296. Now it's time to discuss about section 311, that is grievous hurt, which has got 9 limbs. We have come to describe in detail about grievous hurt. Section 311 of Sri Lankan Penal Code describes as to what injuries should be considered as grievous. It has 9 limbs from A to I. As the first limb, it is emasculation. That means due to the injury, a man makes unmanly. So it could be due to physiological damage such as testicular damage as castration or cutting of penis, or it could be due to physiological damages to vessels or nerves. And also it should be permanent one. You also have to understand this limb is only be applicable for males, and also it is difficult to diagnose this condition as well. Moving on to the limb B, that is permanent privation or impairment of the sight of either eye. What do you mean by privation? The simple explanation is loss. Then it reads as permanent loss or permanent impairment of either eye. There may be lots of examples and we are not going to discuss. The limb C is permanent privation or impairment of the hearing of either ear. Again, it reads permanent loss or permanent impairment of either ear. Again, there may be lots of examples. And moving on to the part D, it says as privation of any member or joint. So now it's time to learn about the meaning of a member. According to the law, a member is nothing more than an organ or a limb capable of performing a distinct function in the sense of genitals, eye, ear, nose, tongue, hands and feet. You can understand we have described about genitals, eyes and ears. So you have to understand within this limb D, we are leaving to discuss about nose and tongue. So privation of any member means under the limb D, we are going to think or refer to nose and tongue. And what about a joint now? Again, privation of a joint. So how can a joint be lost? There could be two possibilities. The first one is permanent fixation of a joint could be due to fibrous or bony ankylosis, or it could be due to simple amputation as well, leading into the loss of a limb or a joint. So now this is all about the limb D. As a summary, privation of genitals, eye or ear we have covered under the limb A to C. Privation of nose and mouth we have covered under the limb D. And also destruction of a joint also covered under the limb D. Now, so this is the limb D, privation of any member of a joint. However, we have never discussed about permanent impairment of smell or taste or permanent impairment of a joint. Or it could be considered as even genitals, but at your level we are not going to discuss genitals here. So now, is it necessary to cover such parts or permanent impairment of smell or taste or joint? Yes, definitely. So now limb E serves for that part. That means destruction or permanent impairment of the powers of any member or joint. Destruction of all the members, as I have mentioned earlier, have covered so far. But permanent impairment of smell and taste and power of a joint not covered so far. Limb E does the purpose. That means permanent impairment of smell, taste or a power of a joint will be covered under limb E. It is powers of a joint. that means stiffness of a joint, weakness of a limb. This is the place that you have to think about. The next limb is F, permanent disfiguration of head or face. So it is not any other place but head or face. The next one is limb G, cut or fracture of bone, cartilage or tooth, and dislocation or subluxation of bone, joint or tooth. Here it seems as very complex, but if you can just remember cut or fracture of bone, cartilage or subluxation, joint, tooth and etc., I think this is more than enough. Moving on to the limb H, any injury. I have highlighted here. It has got two components which endangers life or in consequence of which an operation involving the opening of the thoracic, abdominal or cranial cavity. So now these are the two parts. Any injury that might cause endangering life category, or the same injury will asks for a surgery necessitating opening into three body cavities: thoracic, abdominal and cranial cavity. So now this is the limb H. I think here now you might get a little query. First of all, I have described about 4 parts of hurts. That means non-grievous, grievous, endangering life and finally fatal in the ordinary course of nature. Now you might ask, oh, why you are describing again endangering life within the categorization of grievous hurt? Yes, there is a point. I can't help for that. This is how Law had identified the category of endangering life. As a result, whenever you are marking the medical legal examination form as for a grievous hurt, you always have to think that the given injury is also able to consider as endangering life or not. Once I am going to describe about medical legal examination form, you will be much clearer about that part. In summary, you have to understand the category of endangering life is also included under the grievous hurt. The last category is I, that is the 9th limb, any injury which causes the sufferer to be in severe bodily pain or unable to follow his ordinary pursuits for a period of 20 days, either because of the injury or any operation necessitated by the injury. Here actually again you have to think about injury or resulting surgery may cause severe bodily pain or may affect his or her daily pursuits within 20 days. So now this is the summary of this limb. You can understand there are little components here and there, but if you can remember this one, it will be very clear. Finally, you have to understand this. We are not eye surgeons or eye specialists. So in this case, we have to refer the patients where necessary for the useful expertise. And also, when it is necessary or indicated, we have to review the patient before finishing the categorization of hurt, as in permanent disfiguration of head or face. That means we have to give an adequate time to heal the injury, or it may be due to assess it, that means we want to assess about the function or permanent impairment of a joint. Yes, stiffness or weakness. That means we have to review. And also, as forensic doctors, we also have to consider the given or the questionable injury itself. We have to exclude about previous damages, etc., while doing the categorization. Time has arrived to try with certain sample MCQs. Permanent disfiguration of chest wall is grievous. What do you think? It is false, as I have mentioned you earlier. It is applicable only for head and face, and should also be permanent disfiguration of head and face. Second one, emasculation is covered under the limb C of section 311 of Penal Code. No, Section C covers about hearing and ear. So it is false. Emasculation is difficult to prove. Yes, it's a fact, right? So we can't tell whether one is important or not. There may be lots of malingering and things, so it is difficult to diagnose. The service of consultant eye surgeon is essential for the limb B, definitely, because we don't know about such aspects or eye surgeon's expertise. Reviewing of the patient plays a key role in categorization of hurt, definitely, because there are certain things that take time to get the permanent damage or to describe about the final result. Acute cardiac tamponade in traumatic origin of 100 milliliter is necessarily fatal. No, it is actually fatal in the ordinary course of nature, because with prompt and proper treatment, there is a possibility of surviving or the patient can be saved. Concussion is categorized as fatal in the ordinary course of nature. It is false. Concussion is categorized as endangering life, because there may be an existing threat to the life in the forms of aspiration or asphyxia, etc., etc. Small pneumothorax is considered endangering life. It is correct, because there is an existing threat to the life. Imagine a situation where you get a large pneumothorax that needs prompt and proper treatment to evacuate the pneumothorax. That means such a condition is categorized as fatal in the ordinary course of nature. Otherwise, patient will die. But this condition is actually the medical team is going to observe because of the existing threat. A cut injury to above elbow involving major arteries is fatal in the ordinary course of nature. It is correct. How to explain this? Now, if injury happens below elbow or below knee, that means there is a possibility of getting arterial spasms and things, or the spontaneous sealing off. However, when an injury happens to a larger vessel, there should be some kind of intervention to stop the bleeding. That means you can understand the difference. Now, existing threat and fatal in the ordinary course of nature, that means without any prompt and proper treatment, the patient will die. So now this is the demarcation. Right. So as a result, a cut injury to above elbow involving major arteries is fatal in the ordinary course of nature. This is true. However, I am going to emphasize that you always have to think about the clinical picture before attempting the categorization of hurt. So now these are really theoretical aspects. That means cut injury or crush injury above elbow or knee usually is considered as fatal in the ordinary course of nature. Below we consider as endangering life, thinking that there is only an existing threat. Severe crush injury to the liver due to runover injury is necessarily fatal? Yes. A bone cut is categorized as grievous? Yes. It defines in the limb G of limb G. Flail chest is fatal in the ordinary course of nature. What do you think? It is basically a medical emergency. It is correct. What do you mean by a flail chest? That means 3 or more adjacently placed ribs had been damaged at 2 or more places, causing impairment of respiratory movements during inspiration and expiration, making malfunctioning of air entry. So you can understand it needs prompt and proper treatment. As a result, it is a medical emergency, categorizing it as fatal in the ordinary course of nature. What do you think about tension pneumothorax? Again, the same story is there. Now there is air within the pleural cavity causing tension to push to the opposite side of the great vessels and heart, causing impairment of venous return. So such an occasion also is considered as fatal in the ordinary course of nature. To categorize non-grievous injuries, section 311 of the Penal Code is helpful. Yes, definitely. So this is our heart. No punishment at court for non-grievous injuries. It is false. Whatever it is, whether it's grievous, non-grievous or something, still an illegal action had been done against a person's body. So that means it covers under hurt. So injury means any kind of harm that had been done illegally uh, to any person in body, mind, reputation or property. However, when it comes to hurt, it is applicable only for bodily harm. So in this case, no punishment, it is false. Even for non-grievous injuries, there may be a punishment of 1 year duration of imprisonment. Bowel perforation due to a stab is endangering life. What do you think now? With the bowel perforation, there may be fecal peritonitis, which is a dangerous condition. So, the person needs prompt and proper treatment, leading into the category of fatal in the ordinary course of nature. So, this is false. If it is just a mere perforation causing very localized injury, yes, we can consider as endangering life, but bowel perforation, clearly it says here bowel perforation due to a stab. So this is fatal in the ordinary course of nature. Permanent wrist drop following an assault is grievous under limb D. It is false. Now this is how that I am going to explain here. Now, to categorize this under limb D, there should be permanent privation of any member or joint, that is the limb D. But here, just the power, or there may be a permanent impairment of a member or a joint. So, in this case, this is not correct. Traumatic stomach rupture is endangering life. What do you think? With the traumatic rupture of stomach, there will be chemical peritonitis, which is a very serious condition where it is necessary to have prompt and proper treatment. So here we need prompt and proper treatment causing causing fatal in the ordinary course of nature. A facial scar that is modified by plastic surgery is non-grievous. Again, false. We can't rely on plastic surgery, etc., etc. This should be categorized as grievous injury since there is a permanent scar, whether it's immaterial to get the ability to modify or not. Injuries resulting from acid attacks to the face, more than one limb of section 311 are considered. Yes, obviously true, because it could be due to eye injuries, permanent ear injuries, permanent disfiguration, or more than 20 days, etc., etc. A loosened tooth not necessarily is categorized as grievous. Yes, it's true. Imagine a situation where you get a root fracture. Yes, it comes as grievous. However, there may be certain other conditions where there is periodontal disease, etc., etc. In this case, in such occasions, we are not going to categorize it as grievous. However, you have to take the opinion of OMF surgeon. Subluxation of a joint is non-grievous. It is false. It clearly states in 311. Injuries categorized as fatal in ordinary course of nature amounts to murder. It is false. Necessarily fatal injuries actually get murder. For fatal in ordinary course of nature, it is attempt murder because person is going to survive with the prompt and proper treatment. The category of endangering life is also under grievous hurt. Yes, we have described it earlier. Injury to the left ventricle is necessarily fatal. It is false. Stab injury to left ventricle considered as fatal in the ordinary course of nature. Imagine now there are multiple stab injuries into all four chambers and it's a mess. So in this case we can consider it as necessarily fatal. However, This injury needs prompt and proper treatment, and without this, patient will die, not necessarily die. Now imagine a situation where you get a stab injury to the right ventricle. Left ventricle stab or right ventricle stab is more serious, as you can imagine, because of the wall thickness of the left ventricle. With the contraction, a stab injury on the left ventricle may seal off the injury, causing less bleeding. However, the same injury, if it happens to the right ventricle, it is more severe because of the thin muscle. There is less ability to seal off the bleeding. The same theory applies in case of atrial stab injuries as well. Atrial injuries are more dangerous than ventricular stab injuries, again because of the muscle thickness. A cut injury to the common carotid artery is fatal in the ordinary course of nature. It's true. Severe bleeding. Prompt and proper treatment is needed. Limb G covers pathological fractures. No. We are going to think about only traumatic injuries. Fractures of bones that heal without complications, such as bony ankylosis, are covered in the limb G. Yes, it's true. Now, what I want to highlight here is simple fractures, just fracture. So, we are going to categorize such injuries under limb G. However, with fractures of joints and everything, we are going to think about limb D or E. Categorization of hurt essentially needs to correlate with the clinical findings. Yes, it's very true. We have to think about clinical picture of the patient before finishing the categorization of hurt. Tympanic membrane rupture can be a non-grievous injury. Yes, true. That means if the injury is going to heal without any complication before 20 days, yes, we are going to categorize it as non-grievous injury. Traumatic eye injury completely recovered within 2 weeks after surgery is non-grievous. Yes, it's true, because no permanent damage or permanent impairment or less than 20 days. So it is a non-grievous injury. Traumatic dislocation of a healthy tooth is grievous. Yes, it's true. Negative laparotomy following a road traffic injury is grievous. Yes, it's true, because limb the limb H says necessitating opening into any body cavity. So it is immaterial whether the finding is positive or negative, opening into body cavities. So as a result, negative laparotomy is also considered as grievous injury. Pulmonary thromboembolism following a femur fracture counts as endangering life. It's true. Now this is how that I am going to explain it. Now fracture itself is a grievous hurt and no existing threat there. However, at the time of your examination, now there is an existing threat because of this injury. That means pulmonary embolism. The patient may die. As a result, you are going to categorize this fracture as endangering life. The injury made the life endangered, and this existing threat may cause death. So now you can write as a comment there, right? So now you have to understand it. The initial injury is grievous, but with the development of pulmonary thromboembolism as an existing threat, the categorization of hurt made as endangering life. Transfusion of 2 pints of blood immediately following the assault due to injuries is fatal in the ordinary course of nature. That's true, because now it says immediate transfusion. So that means it is not due to certain other conditions, but there had been a lot of hemorrhage and etc. etc. If the patient did not get these 2 pints of blood, his life is in danger and patient will die. So as a result, this is true. Runover injury on a foot necessitating amputation is grievous under limb D. It's true. It's true. The reason is limb D says privation of any member or joint. So this is loss. So we are going to categorize it as grievous under limb D. A small degloving injury that was necessitated transfusion of 2 pints of blood after 2 weeks of admission is non-grievous. I am going to mark it as true. Because the initial injury, we are going to think about initial injury, it is a degloving small laceration. So injury per se, it is a laceration. There may be lots of reasons where the patient was necessitated blood transfusion because of anemic status. We never know about the causes. As a result, we have to think about the clinical conditions and the persisting conditions as well. However, I am going to categorize this as non-grievous. And true. Potential risk of developing meningitis due to a skull fracture made the injury endangering life. It is incorrect or false. The reason is it is just a potential risk. Now, at the time of your examination, if there is meningitis, that means developed meningitis, you can consider it as a case of endangering life. Hemiplegia or paraplegia following a case of assault is non-grievous. What do you think? What do you think about the categorization of hurt? It is fatal in the ordinary course of nature, grievous hurt or non-grievous? Actually, it is considered as grievous hurt. The reason is, now hemiplegia or paraplegia we can consider as privation of any member or joint, or could be a permanent impairment of a power of any member or joint. So now basically under D and E we can consider these conditions as grievous. So this is an incorrect statement. It is the duty of the medical officer to consider pre-existing diseases before categorizing injuries. That's true. Otherwise, as an example, if a partially blind person or blind person get an eye injury due to trauma, now he is going to pretend this eye injury or the blindness is due to the present incident. So you have to think about pre-existing diseases as well. So this is correct. To appreciate the permanent scar formation due to a facial laceration is be assessed as early as possible upon discharge. What do you think? It is false. We have to provide time for permanent healing. Then only you are going to review. But there are certain occasions where you have to review people immediately. It depends on the clinical condition. Only the initial injury is permanently considered. Only the initial injury is primarily considered when categorizing hurt is done. It is not correct actually. There are instances where you have to think about initial injury and the resulting complications as well. So as a result, I am going to mark this injury as false. Intentionally, I have included ambiguous statements in the above MCQs to discuss facts. I would like to thank Consultant JMOs Dr. LBLD Alvis and also Dr. Prasanna Dasanayaka with much gratitude. Let's wind up the session with a big thank you for you all.